We got the massage guns in. I want to go through, I just want to show everybody when you purchase the massage gun, what you are getting. So you've got the massage gun, you got the charger. Here, you've got all the different tips. So you got a total, you got 1, 2, 3, 4, 5 different, the removable headpieces to them. I personally, this is my favorite tip right here. Would be considered the round flat head.
It's the biggest one in the box,
yes,
isn't it?
It is the biggest one in the box. The reason I like this is I go over large muscle groups. Let me show you quickly how to turn it on. Very simple. 1 speed, 2nd, 3rd, back to 1st, and off. Also, we've got different angles depending on how you need it. Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, well, you made a long drive to get here.
Yeah.
From Louisiana, so definitely quite some time. How long was that?
I think it was 12 hours.
12, okay. So
We stopped a lot.
So 12 hours to get here, definitely quite a trip. Now what is the what's the chief complaint today? What's going on the worst?
My back,
Okay.
shoulders, and neck.
Okay. Now I know you were telling me just a couple weeks ago you went to pick up your purse, put it over your shoulder, and something happened and you literally couldn't even like move your neck.
Yeah.
Alright, and then that kind of gradually went away a little bit?
Yeah, just after rolling it out and stretching it.
Okay. Alright, so the neck, what's going on in the neck that you're feeling right now?
Just super tight, tension. It's always just stiff. It always feels like I have to crack it, but I can't crack it.
Okay.
And it's just usually when I wake up, it hurts a lot.
Okay.
But then it kind of goes away.
Gotcha. Any issues going down the arms?
No.
Good. Now the upper back.
That's super tight.
Super tight?
Yeah.
Are you feeling kind of in the neck, going across?
Yeah.
Okay, and then going down?
Uh-huh.
Okay, kind of in that?
Yeah.
Okay. A lot of people know of this shape right here, that diamond shape going from the cervical spine, going across the shoulders, and then going from that upper back and that middle back going down. Kind of following the traps. Lower back.
Yes.
How long have you been dealing with issues?
Since as long as I can remember,
Okay.
years.
And
I think it's on, because like I said, I played sports, so from just
You played college, what was it?
water polo.
It's not a normal sport that you typically hear people
No.
say. It's college water polo.
It's big in California.
Okay.
Which is where I'm from.
Okay. Let me have you lay face down for me. And I'll have you bring your hands right down here. Perfect. Alright, so we're going to start off, we're going to scan the body from that cervical spine all the way down, checking the leg length, and then we'll check the symmetry from the right side of the body and compare it to the left side. So what I'm going to do first, we're just going to palpate, meaning I'm just going to be feeling the spine and the surrounding tissues. Let me know if anything is tender to the touch, okay?
Okay.
That does?
Yeah.
Alright, so she's feeling some tenderness in that cervical spine here. We'll keep making her way.
That's a little tender.
Okay, so multiple spots in the cervical spine. And now we're in that thoracic spine. Okay, so some tenderness in
Yeah, as you were working your way down.
Okay, so we got tenderness in the mid-back. Now we're coming
there too.
Alright, so now we're at that top of the lumbar spine, bottom of the thoracic spine, already feeling some issues.
And right there.
Okay, so the entire spine we can say.
Yeah.
Any issue over that right SI joint?
No, not too bad.
Okay, directly over the sacrum?
That one hurt a little bit.
Okay, and what about that left SI joint?
That's not too bad.
Okay. We're going to come down here to the legs, Check the leg length here. So she's pulling short on that right side here. Now when we scan up, now actually it's very noticeably, the right hip, you'll see right in through here, is actually raised up higher than the left side. And we're looking pretty symmetrical throughout the rest. A little bit high on the left side compared to the right, but it's not, I couldn't really notice much. I noticed it a little bit more upon palpation here, but let's go through. We're going to use the portable massage device first. We're just going to relax everything. Alright, well let's go ahead and get started. And now I know, as you guys always know, I always like to start up top at that cervical thoracic junction here. Okay, and we're going to start on that left side at T1.
Oh my god.
And we're going to drop down to T2 on the right. There we go. Okay, can I have you take a deep breath in and exhale out. One more time, deep breath in and out. Good. And let's recheck that leg length. So when we bring the feet together, still pulling short on that right side. Let me have you sit up on the table for me, and I'm going to have you straddle the table, one leg on either side. Bring this arm up and over, bring that one up and over here. Keep your thighs to the table. We're going to rotate you this way. Look as far as you can over this shoulder. Good. There we go. And lay face down again for me. Good. Still pulling short on the right. Let's drop down here to the sacrum. We're going to stabilize on the sacrum, and I want you to raise that right leg up as high as you can. Any pain, tenderness, tightness with that?
Just on my leg.
Okay. Relax that side. Raise the left side. How does the left side feel compared to the right?
A little tighter, like in my hip flexor.
A little tighter? Okay.
Yeah.
So what I want you to do, I want you to cross the left leg over the right leg. So from here, we're going to do drops on the sacrum. So what your body is telling me is your sacrum is actually pointed a little bit more towards the right side. So what we're going to do P to A drops, just meaning from posterior to anterior, and we're going to put a clockwise torque on the sacrum to bring it back to midline. And uncross, and I'm going to have you bend this knee. Good. And down. Okay. Raise that left side up again for me. Do you notice a difference?
It's a little tight, but it's a little more relaxed.
Okay, so relax that side. Alright, what that's telling me is we got a little bit of a lumbar issue as well. So I'm going to have you lay on your side and face me this way, please. I've got you. We're going to bend that top knee. And now I'll get you a little bit more comfortable. There we go, like that. That. Come a little bit closer to me. Perfect right there. Good. And then flip to the other side. Okay, so we're going to bend that top knee. Good. Let me just drop that shoulder. Good. There we go. And then lay flat on your back. Okay. So I want you to just relax your legs. We're going to do the leg pulls here. You'll feel relief in the ankle, the knee, going up to the hip.
Okay.
You are one of few that actually relax for me when I tell them to. Good.
I felt that like everywhere.
Alright, I'm going to have you stand up. And I'll have you stand right here for me. Arms by your side. Or, sorry, up by your side. Okay. Bring your hands up and over mine. Good. I'm going to lean you back. Squeeze your elbows together. And I'll have you come right here, taking the seat that way. Okay. Was this starting off a little bit different than?
Yeah.
Okay, good. All right. I'm gonna have you bring one arm up and over, the other up and over. Okay. Take a deep breath in for me, and exhale out. Good. And relax right there for me.
Okay.
Good. All right. So now we're gonna do that Y strap. So this Y strap is that decompression. You're gonna feel this from up top, going all the way down.
Okay.
Lift your head up. Good.
Oh!
Good. And relax. And breathe for me. Deep breath in and out. It's a powerful move, that.
Yeah.
Now, one question I always ask everybody.
Uh-huh.
How would you describe that to someone who's never had that done?
I don't even know. Like, it literally just like, it felt like my whole body just cracked, like, down to my toes. Like, it all just released. I don't even know how to describe it. It felt good though.
Nothing to be scared about, right?
No.
I know. You guys obviously, you came from Louisiana.
Yeah.
You made the drive. I know you've seen the videos.
Mhm.
And, I mean, I know you've seen the Y strap.
Yeah.
Yes, it is a little scary, but it does not hurt, right?
No.
Okay, good. All right, I'm going to have you sit on up. And let me have you turn and face that way for me. Good. Stand up. How are you feeling?
Good.
Main things today, increase the water.
Mm-hmm.
No working out, no heavy lifting today. Take it easy. Besides that, if you do need to ice, 10 minutes on, 10 minutes off, no heat after
Okay.
today, just ice
Okay.
first. But yeah, a little bit different than when you first came in.
A lot different.
Was it worth the drive?
Yes.
Good. Neck pain, upper back, how is that?
I don't have it.
Don't have it. And before, when you first came in, did you have the neck pain and that upper back pain, all of that?
Yeah, actually, when I woke up this morning, I was trying to crack my neck and I couldn't.
And yes,
Oh,
hopefully.
it feels better now.
Trust me,
At first, it like hit me, but now I'm fine.
Trust me, that first, like getting that decompression done, like you see people on the table, they lay there like, holy crap, like it's like, it legit is a shock to the system for a moment. And then it's like the more you kind of relax, your body just, it like gets back to like, it gets back to like that equilibrium where it should be. And it's like, oh my gosh, I didn't know I could feel this good. And you're kind of like moving around like, but yeah, trust me, you're going to keep noticing the effects for like the next few days.
Okay.
And perfect, just kind of keep us updated, let us know how things are going.
Okay.
And hopefully everything is completely good and we don't have to see you back here too long.
Okay.
My goal with every patient is roughly quarterly, so every 3 months is roughly my time frame of patients on getting adjusted. But I know this is your first time, so I'm happy to be the chiropractor to adjust you. But
Thank you.
you guys, welcome, definitely welcome.
Thank you.
Anyone ever looking to schedule an appointment, go right to my website, drjosephcipriano.com. Send me a message, and as you can tell, she drove from 12 hours away to get here. Finally found the relief she's looking for, so thank you, and let me help you guys out as well at home.